Next section is the shoulder joint and the shoulder girdle. As I said earlier on, the shoulder joints, they have about 16 different movements, right? Most of the time when your clients are with you, they may only move their hands in front, above, to the side and back, but they don't actually do more than that. Or they may occasionally bring a hammerlock up and do some rotation with their shoulder and so forth, but very rarely. Okay, so what we're about is to increase more mobility. In order to increase more mobility, we've got to have more space in those ball and socket joints. So to do that, we have to again get right in the joints area, and we just press along here, and then we roll the muscle up towards me. Now, we hold the arm up here for a specific reason, because as we rotate, we actually get in deeper into the ball and socket joints. We're not trying to work the muscle, we're looking at working the tendons and the actual joint, right? Now, no matter how much you work with these clients, the shoulder will feel a little bit tender and sore. Okay, then what you do next is you stretch. I've applied some oil on here, so it gives it a nice smooth movement and not a rough, tight, sandy paper. So, and you stretch that back that way. Then you continue to roll again, and each time you try and press and bring the muscle towards you, like so. Okay. Next thing we do is we work the triceps. That will assist also with the tension that's in the shoulder joint, or they may have a neck pain that the triceps may be responsible for. So to do that, we press right in the middle of the triceps, right into the humerus bone, and we roll the muscle outwards like so. And just right all the way that way, and then downwards. Right, downwards. Right into the humerus bone and roll the muscle down. Now that you've opened the gate, what you want to do now is close the gate. So you roll it upwards, like so. Roll the muscle upwards, roll the muscle downwards, so that you close everything. Right? And that's the tricep muscle. That helps to loosen the tricep muscles, especially when you've got antagonistic muscles where you need, when you're doing a bicep bend, you need to make sure that the biceps tight but the triceps are loose. Then you bring that to the side, and then you do the deltoid muscle. You've done the triceps, we now move to the deltoid muscle. To do the deltoid muscle, basically it's between the points of the edge of the bed is where the deltoid muscle. And that helps you to lift things up, like so, or above your head. So if you have a problem with lifting your arms above your head, normally we're looking at the deltoid muscle as being part of that area. So to do that, make sure your posture's in line again, and then you just press down, and then you split the muscles. Press down, you split the muscles. That's really important. Right down to the bottom of the deltoid, and you do the other side. That's important then. Once you've done the splitting, then you close the door. Posture, stance is important, and you roll the muscle over, like so. Then you move into the brachyradialis. Stances are important. Don't sort of stand there doing this sort of thing, because you'll end up with your own sore back. Get in a stance posture so you're actually sinking in or feeling stability. Stretch that out, and then you work the radii muscle. What you do is you press and you just rotate the wrist, like so. Then you do the other side, same thing. And that helps to loosen up the pressure on the joints. Okay. Then we do the wrist joints. Press in and roll it towards the center. Press in and roll it towards the center. It's that simple. And then you just rock left to right, up and down. Give it a little bit of a shake and a little bit of a stretch. And then you bring the arms to the side of the body. And then you do some flattenings, like so. The stances are important, so you'll hear me bring that up quite a few times in our movements. Then we bring the body into a hammerlock. Now, be really wary of hammerlock, because some people can only bring their arms to about here. You don't want to just suddenly reach their arm up, okay? Then we've got another problem which they never had, which you created. So we take it up gently and we just size. Is that okay for you?
Yeah, that's fine.
Then what we want to do is expose the scapula. So you just gently tap the shoulder until the wings come up, right? The scapula. Then you run your arms along the side and just shake it a little bit to expose that further. 3 movements like you can do in Swedish, backwards and forward. Feel it, so you move a lot of the rotator cuff muscles, the supraspinatus and tensor fascia, move it along there. Actually, not tensor fascia. That's the leg. Okay. And then you just rotate the shoulder joint. See the flexibility of it. And then we start to proceed to work the joints more. So we bring that upwards. This one we apply some pressure on, like so, because there'll be a lot of little bubbles and a lot of knots in that area, and we're trying to release them. Or you can then work by gently ironing out the knots, like so. Of course you need to apply some oil on there so it's a smooth movement. Not too much oil, just enough so it's not too tight. Bring the arms upwards and do the repeat again, that area. Come out to the side, because what you want to do is create more space in the joint, so you pull the joint out as you massage. Right inside there, you pull that out. And then you keep that moving. Now, some people you find will only get to here, so you may have to move it a little bit further, sorry. And then you pull out, and then you rotate the shoulder. Then you rotate the shoulder, because basically what you want to do is you want to make sure that the shoulder is able to be moved and you're creating more space. As you rotate it, you also stretch it out. Just rotate and stretch out. Rotate and stretch out. Then you work the triceps and the deltoid more. Bring that up a little bit further, and then you repeat the movements. Rotate and stretch. Rotate and stretch. Then you bring the arms up, and you put that into your deltoid or your shoulders and lock it, and then you stretch it forward to allow that to stretch forward a bit more. Okay? Once you've stretched it, and then you bring the arm up here, stretch that up a little bit further, get into like a figure 4, and then you stretch these muscles a bit more by just leaning on it, like so. Leaning on that, or you can pull the hips up as you stretch the upper back and the lower back. From here, you can also apply oil along here by massaging and ironing out any knots of tension in the muscles. What I'm looking for basically is these shoulder joints. When you bring that up into here underneath like so, you bring that up underneath like so, you step to the side, lock that into your biceps, and then you stretch that again. Okay, you stretch that muscle again, so that stretches that joint. Bring that, see how it can come right up to there? Some people you might find in the beginning may only come to here, but as you continually work with this client, you'll find that they'll get more flexible in that area more and more, which will then reduce a lot of tightness in the shoulder and a lot of headaches and tension in the neck.